Well, in other news this evening, with COVID-19 constantly mutating and producing variants that may become less immune to current vaccines, drug companies are pushing the idea of booster shots. But one of the country's top infectious disease doctors told our Cleopatra Murphy, not so fast.
Director of the National HIV/AIDS and Infectious Disease Program, Dr. Nakia Forbes, says now is not the time for booster shots. Her comments come as drug maker Pfizer says it intends to seek approval from the Food and Drug Administration due to waning immunity of its COVID-19 vaccine, in large part after a study in Israel suggested the Pfizer two-dose vaccine was just 64% effective against the fast-spreading Delta variant.
There isn't clear evidence that at this time that the immunity from these COVID vaccines is waning or reducing itself to the point where a booster is scientifically recommended. So the science does not point to that yet, right now, where we are in terms of COVID vaccines. And so that is what doctors like myself look at.
From a public health perspective, Forbes says the country must look at equity for vaccines and making them accessible to everyone when there are many people who would not have received their first vaccine shot. With the U.S. now vaccinating children, the question is, should the Bahamas follow suit, particularly after a 5-month-old girl died last month from the virus? Forbes says countries have been asked to prioritize vaccination, something the Bahamas did initially by servicing high-risk individuals first.
And then you can eventually get to children. And so each country has to weigh that in their context. Now, remember that children can get COVID-19, and they can spread COVID-19. And so countries will have to weigh that. And they'll also have to think about children with comorbidities when they are making their rollout plans for children. But we do know that the Pfizer vaccine is available for children who are 12 years of age and older. And so, like I said, it really depends on accessibility and equity.
With the Delta variant now posing a bigger threat to the Bahamas, Dr. Forbes is cautioning the public not to slack off on safety protocols and get vaccinated when the opportunity arrives.
There is COVID surges going on, not just here. Globally, you can see that, and there's a reason for that. And it's largely because of new variants that are more infectious, people not following the public health precautions properly, and business as usual, reopening business as usual, and the movement of people, and the inequitable rollout of the vaccine. That's what's contributing to all of this.
Cleopatra Murphy, ZNS Network News.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage, web exclusives, and much more.